Hello y'all nursing students. If you're studying for NCLEX, don't skip this video. We have 15 questions case study all the time, NCLEX style. So let's go to question number 1 without further ado. Are you guys ready? Okay, so let's go to question number 1. Danny is a 59-year-old patient admitted for monitoring after a syncopal episode. The telemetry shows normal sinus rhythm at admission. During breakfast, the patient presses the call light and says, "I feel tight pressure in my chest." The vitals are 132 over 86. The respiratory rate is 94. Uh, I'm sorry, pulse rate is 94, respiratory is 20, O2 sat is 96, and there are EKG changes in the telemetry. As you can see, there is ST depression in leads 2, 3, and ABF. So the question is, what is the nurse's priority action at this scenario? So letter A, increase IV fluids rate to improve perfusion. Letter B, apply oxygen at 2 liters nasal cannula. Letter C, ask the patient to describe the pain using a scale of 1 to 10. Or letter D, ensure the patient is resting and limit movement. So I'm going to give you a 10-second timer. Okay, so the best scenario is to take a 12-lead EKG because the patient is already having ST depressions. However, 12-lead EKG is not part of the choices. So we will make use of what the choices are, and the best answer for question number 1 is letter D, and that is ensuring the patient is resting and limiting movement. So why is that the correct answer? Remember, reducing myocardial oxygen demand is essential during suspected ischemia. So resting is a direct nursing intervention. So let's go to question number 2. Now this is the same scenario, Danny, who's having ST changes already. And the next question we have is, which medication would the nurse expect to give based on the current symptoms and ECG changes? 10 seconds. Okay, so the correct answer here is, of course, letter B. So remember, ST depression and chest pressure indicates myocardial ischemia. Nitroglycerin improves perfusion by vasodilation. So let's go to question number 3, and this time we have a different scenario. Leah is a 41-year-old patient post-op day 1 after abdominal hysterectomy. Her current medications are IV morphine PRN for moderate to severe pain. These are your assessment. Pain is 8 over 10. Respiratory is 10. The patient is arousable but drowsy, and the O2 sat is 94% at 2 liters nasal cannula with a blood pressure of 106 over 68. So our question is, what is the best nursing action based on your assessment? Okay, so of all the 4 choices that we have, the best answer is letter C, which is elevate head of head and encourage deep breathing. So remember, patient is oversedated with borderline respiratory status. Nursing priority is to stimulate ventilation before reassessing pain or escalating the care. Question number 4 is another patient. This time it's Jordan. Okay, so Jordan is a 28-year-old patient admitted for major depressive disorder. The observation or your assessment: withdrawn but flat affect, refusing group therapy and other meals, tells nurse quietly, "I don't see the point of going on anymore," and there are no family visits. So question number 4, what is the nurse's priority intervention based on the case study? Okay, y'all, thank you. So the correct answer for question number 4 is letter A. Ask the patient if they have a plan to hurt themselves. So suicide assessment is never optional. Asking directly about the plan and intent is evidence-based and within the nursing scope of practice. Question number 5. So a new case study. Kevin is an 81-year-old recovering from a hip fracture. This is the status: bedbound, requiring two-person assist to turn. The skin is intact but red area noted over sacrum which are non-blanchable. The nutrition: poor intake, low albumin, and the pain score is 3 over 10 out of uh, 3 over 10 at rest. So the question is, which intervention is most effective in preventing progression of the sacral injury? 10-second counter. Okay, so correct answer for question number 5 is letter C, which is place patient on a high air loss mattress. Advanced support surfaces like high air loss mattresses reduces pressure and moisture buildup, which is key in prevention. So, okay, 5 questions are done. How are you guys doing? Good, good, good. So let's start with question number 6. This time it's Helena. Okay, so Helena is a 63-year-old which is 36 who is 36 hours post abdominal surgery. These are the following assessment that you have: IV fluids of LR at 100 ml per hour, Foley catheter removed 8 hours ago, reports mild lower abdominal fullness. The vital signs are as follows: 92 heart rate, blood pressure 128 over 76, the temperature is 37.1, no void since the Foley removed 8 hours ago, palpable bladder above pubic symphysis. So the question: which nursing action is most appropriate? 10 seconds. Okay, so the correct answer is letter A. So remember, first line nursing action after Foley removal is to promote natural voiding. So ambulation, upright positioning, and of course, privacy. Let's go to question, let's go to question number 7. This time it's still the same scenario, but the question is, if the patient is still unable to void after non-invasive measures and reports increased discomfort, what is the next best action? Okay, so the correct answer for question number 7 is letter A, perform a bladder scan. So bladder scanning is very non-invasive, usually nurse performed, and helps determine if urinary retention is present before catheterization. Let's go to question number 8. So this time it's Mark, 55 years old, receiving insulin for type 2 diabetes. The blood sugar is 84. The order on admission is administer 10 units of regular insulin, sub-QT ID with meals, the meal tray not yet delivered, and Mark looks alert, says he feels fine and wants to get insulin over with. What is the nurse's best action? Okay, so we know this is a diabetic patient, right? So the correct answer is C. Wait to give the insulin until the meal is at bedside because we know what's going to happen next, right? Regular insulin peaks in 2 to 4 hours. Giving it without food nearby risks hypoglycemia. Let's go to question number 9. This is another case study. Valerie is 71-year-old recovering from hip surgery. mobility order out of bed to chair with assistance. The findings: alert, slight dizziness when sitting up, pain 3 to 10 in the hip. You and your UAP are assessing her to sit on the side of the bed. What should the nurse do before proceeding with the transfer? Okay, you all, question number 9. The correct answer is letter B. Apply a giant belt. I'm sorry, apply a gait belt and assess for balance. No, that's funny. A gait belt. Promote controlled, safe transfers and give the nurse feedback on postural stability. That's funny. Question number 10. Carlos is. Sorry. Oh, I gotta stop. Okay, so I stopped laughing. Sorry. Clarence, 68 years old, patient admitted for CHF exacerbation. The IB meds are digoxin 0.25 milligrams ordered once daily. The vital signs before administration are the following: the heart rate of 56, the blood pressure of 122/70, the respiratory rate of 18, then the O2 saturation of 96%. So patient heart failure DIG. And then the potassium level, because it's very important, it's 3.2. So the question right now is, which nursing action is most appropriate before giving digoxin? Okay, I'm pretty sure you guys got this correct 100%. The answer is letter D. We'd hold the digoxin and assess for signs of DIG toxicity. So remember, bradycardia and hypokalemia increases the risk of digoxin toxicity. What are the signs and symptoms? Remember GI symptoms first, followed by visual symptoms or visual changes, and then you're gonna end up with some arrhythmia. So GI changes would be nausea and vomiting, and then visual changes. Remember those halos that we talked about, and then of course with hypokalemia, you're gonna have some PBCs and U waves in your EKG. Holding the meds and assessing further is a safe nurse initiative or initiated action. Very, very safe. So question number 11. So we're gonna go question number 11. This time we're taking care of Doris, a 77-year-old dependent for hygiene and mobility. The status: the patient is oriented, incontinent of urine, and skin is intact even though they're incontinent. You are preparing to give her a bed bath. Which action supports both hygiene and skin integrity? Okay, so question number 11, the correct answer is letter C. Use warm water and gentle cleanser, pat the skin dry. So gently cleansing and thoroughly drying protects the skin from having injury. So it's actually the drying component of it, and gentle patting protects skin barrier and reduce moisture associated skin damage. Question number 12. Let's go to question number 12. This time we're going to go to Leland, 32-year-old, admitted for new onset seizure evaluation. The orders are seizure precautions, of course. Assessment: the patient is alert, oriented, no recent event, which is good, right? Which action should the nurse take to prepare the room safety? 10 seconds. Okay, so if you chose letter D, you got it right. Ensure oxygen and suction are set up and functional. So Airway support is critical during seizures. Suction and oxygen must be immediately available when it occurs. Question number 13. Let's talk to Linda, or let's take care of Linda. Linda is a 75 years old, recovering from stroke. The diet is mechanical soft with nectar, thick liquids, of course. Findings: coughing when with thin liquids during previous meals. You are preparing to assist with lunch. Which is the safest technique for feeding this patient? Okay, so out of the four options, the best answer is letter B. Alternate bites of food with sips of nectar thick liquid. This reduces oral residue and aspiration risk. Thickened liquids are easier to control and swallow. Question number 14. Sam is a 64-year-old patient with COPD exacerbation. The autosat is 90% at room air, and the order is to give oxygen to maintain autosaturation between 88 to 92%. So the question is, which oxygen delivery device is most appropriate for Sam? Okay, y'all, the correct answer is letter C, nasal cannula at 2 liters per minute. Nasal cannula allows precise, low flow delivery, which is ideal for COPD patients where CO2 retention is at risk. And let's go to our last question, which is question number 15. And this time is Naomi, 70 years old, has a stage 2 pressure injury on the sacrum. You are assessing the wound and documenting your findings. The question is, what is the most accurate examples of objective documentation? Okay, the correct answer is letter C. This is describing the size, the depth, and tissue characteristic is very, very objective, measurable, and very clinical. So we had 50 questions. What was your score? If you're able to share that in the comment section, that would be great. Thank you for watching. And like I said, I'm new on YouTube, so if you could subscribe, that would mean a lot. Thank you for watching.